Hello, Jenna. Can you hear me?
I can. Hello, Julian.
Hi, Julian.
Hi, is that Georgie?
Hi, it is.
Hello, Georgie. Excuse me being a little late joining.
Perfect timing.
Hello, Jenna. Yes.
Hi, Julian.
That's what I was hoping. Hello, Andrew.
I
How are
can.
you?
Hello, Julian.
Good,
Hi,
thank you.
Julian.
You well?
Yes, yes. So,
Hi, it is.
surviving the lockdown. How are you doing?
Yeah, we're in Lancashire, so we're in Uber lockdown.
Oh gosh, yeah.
Hi,
Yeah,
Julian.
very complicated, isn't it?
It's depending on which side of the street you're on.
Well,
There's different
I know.
rules.
Yes, I know.
Hi,
People, whole families are separate.
the lockdown.
I had a friend who said,
Yeah,
I mean, off the record,
we're in Lancashire,
Andrew,
so
how
we're
you
in
guys
Uber
manage all this
lockdown.
stuff.
Oh gosh,
nothing but
yeah.
admiration
Hi,
for you.
Julian.
Because the guidance is a little strange.
Depending on which side of the street you're on. It is different
I
rules.
know. You can't go one side of the street
Whole
to a house, but you can all live in the lockdown. I had a
That's
friend
it,
who
yeah.
said, I mean, off the record, Andrew,
You can
how
go
you
to the
guys
pub or
manage
go
all
on
this
holiday,
stuff.
but you can't have anyone round to your house.
The guidance is a little strange.
Depending on which side of the street you're on.
Anyway, so I think the great tradition of British policing of reasonableness and
That's it.
has come through loud and clear in all my interactions with them.
Oh, that's good.
Obviously, we're Met down here, but family all over the place. So various police forces seem to be managing somehow or other. So well done.
Sensible balance. In the traditions of British policing, we're asking people if they wouldn't awfully mind doing the right thing. It's not too much trouble to bother you, yeah.
Yes. Oh dear.
Okay, so we've got about 3 minutes before 1 o'clock. So I think we are just letting a couple more people join the event now. So just quickly for those on the call, my name's Jenna and I'm from Oscar Kilo. I'll be moderating the event today. And the first thing I will do at 1 o'clock is to introduce Chief Constable Andy Rhodes, who will introduce you all to the event. So we'll just give everybody another minute or so, and then Andy, I will hand over to you.
So seem to be doing quite well. 75 people on the list that I can see. So
Which is good for at the moment, as a lot of people are on annual leave, we were saying. So
yeah.
positive.
Including me, Georgie.
I know. Well, we feel very privileged then that you've joined us on your on annual leave.
Well, it wasn't a long commute, I have to say.
Yeah.
Just have a shave, put a shirt on, and there I am.
We've got confirmation the live stream is working, so all good. We're at 81 now. Should we give it a couple more minutes, Jenna? There's still people coming in.
Yeah, so is this running live now? Can the participants hear the conversation now? Excellent.
Yeah.
Wonderful.
Afternoon all.
Okay, lovely. So we've just ticked over to 1 o'clock. So we'll get the event started so we can keep to time. And first of all, I'll introduce Chief Constable Andy Rhodes to open the event. Thank you, Andy.
Thanks, Jenna. Welcome, everybody, to the first global conference on the subject of wellbeing and technology, where we're going to share and explore our experiences during the COVID-19 pandemic. My name's Andy Rhodes. I'm the Chief Constable of Lancashire Police in the UK, and I'm also the National Lead for Wellbeing in UK Policing. Today, we've got guest speakers and facilitators from across the world joining us, so thank you to them for giving up their time, and also, of course, to yourselves for signing in. We aim to make this a really interactive, enjoyable session where you can get the chance to contribute. So we do have some activities as we move along through the conference for you to take part in, so please keep your eyes peeled. So why have we arranged today's conference? Well, firstly, the Oscar Kilo team, which coordinates the wellbeing support in the UK for over 200,000 blue light workers, has been networking across different countries for several years now. And we really do have a thriving community and a genuine global network. Many of those people are on the call here today to share their experiences. And COVID, right from the outset, has really shown the benefits of that network. We've shared research, experiences to give the best for our people, because COVID has really pushed wellbeing to the forefront of employers' minds. And so we wanted to bring the technology community together today with the wellbeing community to share our experiences, learn from what people are doing across the globe, because technology has been highlighted in much of our research and staff surveys as a key priority when it comes to business continuity, particularly in critical services like policing and other blue light services. So the Oscar Kilo team has collaborated with techUK to set up today's conference, and we have guest speakers as follows: Grant Edwards from Australia. Special thanks to you, Grant, for anyone else from Australia, because it's pretty late down there. So thanks for that. We've got Dr. Katie Kamkar from Canada. We've got Gary Bottrell from the UK. Hector McCoy from the City of London Police. Jeff Thompson from NYPD. I think it's quite early there still for you, Jeff. And Julian David, the Chief Executive Officer of techUK, who's come in off his leave to help us today. So thanks for that, Julian. Will be facilitated along through the conference by an amazing team who've been working hard to get us all online here today. Celine Schillinger from We Need Social, top tip folks, Google Celine, read her blogs. That's all I'll say. Jenna Flanagan from Oscar Kilo, Georgie Henley and Richard from techUK. Massive thanks to all you guys. So I'll get out of the way now and hand over to Georgie, who's going to give us the housekeeping rules.
Thanks, Andy. And yeah, no, good afternoon, everyone from the UK. So I'm Georgie Henley, so techUK's Justice and Emergency Services Programme Manager. So as Andy's already mentioned, we've been working closely with partners Oscar Kilo on this event, and are delighted to welcome techUK members, stakeholders, and of course partners from other parts of the world. So before we begin, I just wanted to run through a couple of housekeeping bits. So please make sure you remain on mute for the duration of the webinar. If you're having any technical issues, please can you send me, so Georgie Henley, a direct message via Zoom, and I'll do the best I can to sort this issue for you, but hopefully everything should be seamless, fingers crossed. There are a number of opportunities throughout the session to ask questions, and we really do encourage you to take advantage of this with such an excellent panel. To ask questions, if you could just pop them in the chat function to everyone, and then Jenna, as the moderator, will then pose the question to our panel. If you could also include in your question who from our panel the question is directed at, that will make it sort of a bit easier for Jenna as well. And just a quick reminder as well, this event is being recorded, and it will be available after as part of our event summary. And at the moment, we are also live streaming as well. Yeah, no, that's it from me. I'm delighted to now hand over to Jenna as our moderator, who will introduce our speakers. So Jenna, over to you.
Thank you, Georgie. So good morning, good afternoon and good evening, depending on where you are in the world today. My name's Jenna. I'm the Digital Resource and Engagement Manager for Oscar Kilo, and would like to thank you all for taking the time to be here today. So you've seen the agenda for today, and as Andy and Georgie have said, we do have a couple of little activities for you and some live polls. So the first thing we're going to do is we're going to move into the keynote speeches. But before we do, we're just going to run our first live poll. Georgie, if you can press the button. And so our first poll for today is just to get a sense of how people have been agile during this period. So if you have had to work from home as a result of the pandemic, have you had access to the technology to successfully allow you to work from home? So we're just going to give you another 15, 20 seconds to quickly vote, and then we'll have a look at what the results come back on from that. So if you've got access now, just yes or no to that question. And here we go. Right. So out of everybody who's taken the time there just to access the poll, that's encouraging. So 93% of you have had access to the technology to allow you to work from home. So that's brilliant. So that reflects a lot of what we've heard actually through survey work we've done ahead of this event, so that we could get a sense of what the picture has been like for everybody. And really, this session is around the impact of technology on people's well-being. So what we're going to do is look at the different aspects of that now. So what I'll do is I will quickly introduce each of our keynote speakers, who are Dr. Kati Kamkar, who is a clinical psychologist at the Work, Stress and Health Programme and Psychological Trauma Programme at the Centre for Addiction and Mental Health in Canada. Then we'll have Sergeant Gary Botterill from Surrey and Sussex Police, who's a serving police sergeant and co-founder of the Backup Buddy mental health app and Service Dogs UK charity. And then Julian David, who is the CEO of techUK, who we've partnered with to bring the event to you today. And alongside being the CEO of techUK, Julian's also a member of the UK Government Industry Cyber Growth Partnership and Digital Economy Council. He's the Vice President for the National Trade Associations at Digital Europe and Vice President for Europe at the World Information Technology and Services Alliance. So he knows what he's talking about when it comes to technology. So without further ado, I'll hand over to Kati for our first keynote speech. Kati, over to you.
Well, good morning from Toronto, and what an honor, sincere honor and pleasure to be with all of you today, and thank you so much for having me. As we do know, police are exposed to a unique set of challenges, in addition to always being the first responders to deal with the public during high-risk situations. With the COVID-19 pandemic, we do know that it has presented with additional occupational stressors, and just to name very few threats and assaults from the public, as we know, the risk of being exposed to not only to the virus, but the fear of also spreading the virus to the loved ones once we go home. And we do know that once there is a concern of bringing harm and threat to home, then home is no longer a safe place. So definitely exacerbating the stress. Witnessing the devastation that families have to go through, separations and not being able to reunite, having to respond to increasing calls related to domestic violence and child abuse, in addition to having to enforce rules around business closures and witnessing, of course, the financial devastations, in addition to the low morale that can result from the negative interactions with the community. What is very interesting, if we look at the pattern and certainly the impact of COVID-19, is that a lot of those stressors are very much interpersonal oriented, so interpersonal related trauma. And as we know, when we are in a human service profession, in a human care profession, those interpersonal type of trauma increase the risk for, as we know, for example, burnout. And burnout is a sense of exhaustion, the sense of cynicism that might take place, along with this negative self-evaluation, this lack of professional efficacy that might take place. Also, as we often hear, this moral suffering, moral distress. Anytime we might question, did I do the right thing? Did I do enough? Or any transgression of, let's say, our moral standards, moral values, anything that might lead to this inner psychological disequilibrium can lead to the stage 2 moral distress. And of course, compassion fatigue, once again, in any human care profession here, is this intense preoccupation. And when we start sharing and being overwhelmed with the pain and the suffering of the ones that we are trying to help, more so than the trauma. So certainly, of course, within policing, we know there is an increased risk for operational stress injuries that we often hear. So operational stress injuries are the persistent psychological difficulties that result from operational related duties. But certainly those risk factors also contribute to the development and or maintenance and exacerbation of mental health conditions. And certainly we do know through research that even after when we control for potential traumatic incidents, those risk factors can also be significant and single contributors to mental health conditions. So what that means is that in anything that we do, we always need to take into account a whole person management approach, a holistic approach to care, and a comprehensive workplace mental health approach. And so for comprehensive mental health approach, as we know, is the importance of healthy, positive organizational culture, in addition to, as we just talked about, identifying and minimizing workplace risk factors. And so this at both organizational and individual levels, and identifying and building workplace protective factors, workplace strength, again, at both organizational and individual levels for prevention. And when we talk about prevention, it works on the continuum, primary, secondary, tertiary prevention, continuum of care, to build resiliency and for post-traumatic growth. Now, for resiliency, we have proactive resiliency when we are immune and resistant to challenges, and there is reactive resiliency when we need to utilize all the skills to be able to bounce back. And we do know over time, with occupational stressors, accumulation of traumas, tolerance goes down, vulnerability goes up, there is a weakening of the immune system. In addition to a host of other risk factors just we talked about, we can definitely move from proactive to reactive resiliency. And finally, the importance of also knowing that, as we do know with policing, there is exposure not only to traumatic incidents, but as we just discussed, to occupational stressors. And one thing we do know, and especially through most recent research, when we control for traumatic incidents, we have occupational stressors, so both organizational stressors and operational stressors, that once again, when we control for traumatic incidents, both organizational and operational stressors are significant and single contributors to mental health conditions, including post-traumatic stress. Out of all the organizational stressors, two stressors that have been found to have the strongest mental health impact are the one that I need to show value to my organization. And the second one is, so essentially I need to prove my value to the organization. And the second one being that if I am ill, I'm worried, I'm afraid people will look down on me. And in terms of operational stressors, the two that have been found to have the strongest mental health impact are fatigue and managing life outside work. So what that means is that in any prevention and intervention workplace strategies, we do need to identify and build protective factors that can directly buffer against those risk factors. Again, thank you very much for having me.
Thank you, Catty. So we'll move forward now on to Sergeant Gary Botterill from Surrey and Sussex Police. Thank you.
Thank you, and it's lovely to be here. Thank you, Catty. I consulted with my police response colleagues about their experiences through the pandemic and the issues that affected them. And as you might expect, it was the common concerns of what is safe, which PPE should I be wearing, distancing in cars, how do we actually do that? Dealing with the public and the offenders, how can I do this safely? So these were the concerns that my colleagues had. And luckily, through our response to COVID, Op Apollo, we had pages on the intranet which were crammed with advice and information and government updates and local updates pertinent to policing. But we also had a wellbeing hub, which was also full of information, help and support. And I'm pleased to say lots of Oscar Kilo materials as well. Crucially, we had the means to open up a dialogue and obtain live feedback and hear concerns and give employees a voice at that time, not later on, some way down the line, but actually there and then. Anything that was causing them concern, they could feed that back and they would get answers. And we found that really, really impactful. In policing, we always tried to avoid the Q word, but it was eerily calm during the early lockdown. When restrictions were lifted, it became suddenly much, much busier. However, triage teams were excellent in resolving minor offences and allowing the teams to focus on the more serious crimes. Apps such as Backup Buddy were used to relay COVID-19 related wellbeing messages with an array of information and links to mind and body fitness video tips, information advice covering a multitude of topics. And yes, we had Joe Wicks too. This was a great way to reach people shielding or self-isolating, and those coming back from annual leave or sickness or otherwise out of the loop as well. Daily updates and the latest advice was provided via a portal to the police website that was created especially for employees without laptops to access updates and about the pandemic in relation to their work, and people felt connected and not out on a limb. Adjustments internally at stations were made to provide more space, and rigorous cleaning was rampant throughout. The cleaning and estate staff were the unsung heroes in keeping the workplace safe. Policing was uninterrupted in the main, and fewer staff at work meant more space to maintain distancing inside the police stations. So our MDTs, with all the common forms that are used to record crime and input straight onto the police system, with automatic populating forms for crime, sudden death, missing persons reports, etc., remote statement taking and better use of staff to screen out or deal with calls directly, all played a part in keeping the workloads manageable. On the first day of the countrywide lockdown, we went from an average of 45 people remotely connected to over 1,500 every day. These officers and staff were able to contribute to reducing the workload and helping their colleagues on the front line. We brought in teams a year ahead of schedule to meet the demand. We are now running webinars on Zoom. This was not imaginable before COVID-19. Peer support groups, such as the mental health first aiders and diffusers, carry on as normal with video conferencing or socially distanced meetups in appropriate locations, ensuring that vital support was always available. We also highlighted our employee assistance program and the video counselling services that they provide. WhatsApp peer buddy groups sprang up from nowhere, or existing groups were more heavily used as a method to stay in touch and feel connected, to maintain part of the team, the work community. The boots on the ground remained, as always, in tight-knit teams. When the chips are down, it is instinctive to rely on each other. Having the added responsibility of policing COVID, they adapted to the additional pressures, the raft of confusing messages about legislation and proportionality, and the questions about their safety and the safety of the public. The Black Lives Matter demonstrations threw another huge issue into the mix, so that while officers were doing their utmost to stay at work, to do their jobs, to keep people safe, they were also in the position of being damned if they enforced COVID-19 legislation and damned if they didn't. Another aspect of technology that affects policing is the widespread use of mobile phones to video every police interaction. This instantaneous trial by social media from selective clips undermines our good work and can affect our well-being because we actually care about what we do. In summary, the increased use of technology during the pandemic has provided benefits for the front line. There is less expectation for face-to-face interaction with the public in most situations, as most inquiries can be dealt with online, but it has also brought challenges. Some officers and staff felt isolated. There were fewer officers at work, and operational resilience was at times difficult to maintain. However, they were enabled to carry on their core functions, with the more mundane inquiries being handled remotely. To maintain good physical and mental health, a variety of activities were taken up and shared among officers and staff. technology has an increasing role to play in our well-being, in our mental and physical health, and in the chasm of remote working, it can bring a much needed sense of togetherness. Thank you very much for listening. I'd now like to introduce you to and pass you over to Julian David from techUK.
Gary, thank you very much for that intro. And I think, you know, it's fascinating for us working as we do in a more or less standard office environment to think about the additional challenges you have with such a broad spread and wide variety of roles, with a lot of physical roles, a lot of need to be out and about. So, I'm really impressed by hearing those stories. Thank you for that. Look, in the 5 minutes that I thought I would speak, I thought I would do 2 or 3 things. So the first is just those of you who don't know techUK, we are the private sector trade association for digital technology companies who operate in the UK. So very, very small companies through to the sort of international and national champions you will all know and hopefully love. And we have about 850 member companies, and they employ about 750,000 people inside the UK, supplying technology, among other places, to law enforcement and public safety organisations in the UK, the police especially. So it's a great privilege to come here and talk to you a little bit about us. We're 70 people, and we were very analogue, strangely enough, for the Digital Trade Association. We used to have meetings. We convene communities. That's one of our primary roles. Producing thought pieces of papers and proposals is obviously another part of that. But the big thing was getting 24,000 people a year into our offices in St Bride Street in central London. We had 70 staff all working pretty much in the same office all the time. So that meant we were quite analog, and we had to suddenly move overnight. Not the same challenge that I've been reading here. I mean, fantastic numbers you had, but just moving those 70 people and the 24,000 engaged stakeholders and members into an online world. And we were able to do that almost within 24 hours, and which I must admit I was very pleased by. A little bit surprised that we had so few problems with it. And I would think, and it might be worth just highlighting a couple of things that really were important there. The first was the cloud. I mean, if we didn't have the cloud infrastructure in the country, we didn't have the infrastructure provided by the telecoms companies and their suppliers, then we would all have had a significant problem here. The second thing was we did have a base of common applications. And again, I know that's sometimes a challenge across different police forces, but being able to use common applications or interoperable applications is very, very important. The need to have the same set of data, the need to have the same skills, the same functionality that you can use. You can have variants in it, but having a base of common stuff as well. And then that core ability of tech skills to get things going. So what was the result? We managed to move online. We managed to have our stakeholder and member community actually grow by 40% when we started to run events online, when we started to run our communities, when we started to run our councils, all our interaction. So that was a big success. But that's really the sort of mechanics of it. What was actually really the challenge, and really fits with the theme that you're all talking about here, is, but what about the people? I've been, as you can see from my grey hair, a long time in this industry, over 30 years. And I've seen lots of technology, and generally speaking, the key issue in the successful use of technology is making sure that you think about the people. And no time more important than when everything is online. I've got that thing where the doorbell's ringing, but I'm going to ignore it because I think I know who it is. But that also, by the way, is one of the things that's come out of this. People's doorbells do ring. Their dogs do bark. Things like that do happen. And that was one of the things that I think we've all started to learn. And you don't have to be. Your jacket doesn't have to be on a particular chair for you to be effective and work. The first thing then was communicate. So we did really over communicate what was happening, why it was happening, how we were going to set things up, who was going to do what. The second thing was make sure that you keep the team connections. Now, a bigger challenge for a police force, clearly, than we had, but we had 70 people who just used to talk to each other in the office, and now suddenly they're not. Many of those people very young, many of those people sharing accommodation, not everybody in a sort of office environment with a load of books behind. People talking from their beds, people whose connections were not good enough, so they were actually out on the hall or hanging out of a window to try and make sure. So how do you keep the team connections going? And we put in place 2 or 3 things that I've heard variations of in the keynote so far. But the first was, make sure that you actually convene the day or the shift or whatever. So even in a virtual environment. So we used to do all hands calls. We started them every day when we started, just to say, okay, it is work. We are together as a team. We call them all hands calls, and everybody had a chance to talk, and we could get messages across and interact using chat as well. The second thing that we did was to say, okay, let's make some social parts of this. So we actually set up a number of social things. Now here, you are dependent on your team to do this, and what we did was we had things like quizzes and so on, and asked people to bring their ideas for a quiz. And you find interesting talents and interesting characteristics. Celebrates people's birthdays. Make sure that you don't miss that sort of sense of occasion, which is part of a team's life. People know when things happen: weddings, engagements, birthdays, etc. And then the other thing we looked at was, well, can we make sure nobody is alone? Because even in a big conference call, the chance to speak is smaller, and you can get left on the sidelines. So we set up buddies, and Georgie, I know, unfortunately, at one point was a buddy with me. But the idea was to actually match people for a couple of weeks, 3 weeks, and say, okay, talk to each other about whatever you want to talk about, and then make sure that those connections are kept going. Lastly, I would sort of come back to saying, look, that was all a picture of success, you might think. But then, of course, what happens is people start to think this is all very oppressive. I'm on the screen all the time. All the things you're offering me, Julian, are more screen time. Can I come on to an online quiz, et cetera, et cetera. So you have to start to think about that. You have to start to say to people, within the requirements of the job, make sure that you do manage your home life. If you are working from a smaller space, give yourself time to actually get some exercise. Stand up and stretch. You mentioned Joe Wicks. I think that's a great idea, and that sort of thing. So what did we learn from all this? And looking across the broader tech community and its customers. So the first thing was, tech and digital is indispensable. If you don't have a digital capability, and if you don't have the strong ability to manage data, to manage communications, and to manage interaction of people and interoperability of systems, then you will have a struggle. And you can see that from the businesses that are really struggling. Even something as simple as restaurants. If they didn't have a digital connection with their customers, then they could disappear and the customers could disappear. And those that kept that connection have been able to start up again. Understanding how data works and keeping it safe, understanding how you can interoperate. And then just come back to the main point I wanted to make, which is making sure that you don't lose sight of the person. It's not a matter of us all moving online and that's it forever. We are people. We need to socialize. We need to be together, and we need to keep that going. Thank you very much, Gary.
That's brilliant. Thank you, Julian. Absolutely brilliant. All of our keynotes, thank you very much. And I know 5 minutes isn't a lot for each of you to speak when you've all got so much experience, but thank you very much for that. So we are now going to move on to our first panel discussion, which we will close off with the Q&A. I'm noticing some comments in the chat function and some questions that are being directed to different people. So we're keeping a note of those. We'll pick up as many of those as we can during the Q&A, but those we can't pick up, we will do so with our speakers after the event, and we will get those answers and put those in that roundup piece that we do on the Oscar Kilo website after the event. So just to move into our first panel, on this panel we've got Chief Constable Andy Rhodes, Julian David, Gary Bottrell, and they are joined by Grant Edwards of Aspect Group in Sydney, Australia. And Grant is a former commander with the Australian Federal Police as well, and is a very passionate mental health advocate. And this panel is about how we think technology can help police wellbeing, what we know so far, what are the enablers that technology presents us with. So to start this discussion, I'll put the first question to Mr. Rhodes. And from your perspective as a leader within police, and Andy, what has been your personal experience of technology through the pandemic? And what observations do you have of the impact that technology has had? Has it helped or not? Over to you.
Okay, well, I mean, where I come from with this is that we do know, and I think Katie mentioned this, that technology actually can be a pretty big organisational stressor. Certainly in my organisation, we've seen technology pushed at people who haven't been trained enough to use it, and it gets in the way of them doing a great job. That's sometimes how it's seen. So what's changed for us is the fact that, I think as Julian said, that we haven't actually been using and exploiting some of the assets that we've got around technology. We've tended to invest the vast majority of our money in operational focused technology rather than technology that's designed to suit our workforce and support their well-being. And I think what's happened is COVID has sort of amplified and accelerated some of the things that we have really struggled to land culturally in policing. And one of those is flexible working. So technology has really enabled us, the sort of numbers Gary's talking about, with that comes people who are able to have more flexible options at work. When there's childcare, caring responsibilities, we've really been able to facilitate that, which brings me to my second point, which is big organisations, big problem of wellbeing is personalising the support. They tend to provide sheep dip service, one size fits all. And what COVID has forced us to do is personalise our support for people, because a health problem of this scale brings that complexity with it. And the final one, I know Gary, I think, mentioned workload. The other thing that it's done is improve work quality, because actually what we've seen is a load of non-value work being stripped out. And technology has got the ability to sustain some of that, we think. Use of robotics and all the different things that we probably haven't been using enough of in policing, which have been around a very long time. So when we're looking at sustaining the benefits of using technology and wellbeing, it actually could completely change the shape of our capital programme, where we spend our money, but also actually how attractive we are as an employer, because we know new people coming into policing really value flexible working. They want technology that's as good as the stuff they can get at home and all those sorts of things. So I do think as long as we don't snap back to our old ways, which we do tend to do, the benefits have far outweighed the negatives in terms of how we've exploited technology for wellbeing on many fronts.
Brilliant. I think when we briefly mentioned the survey that we ran ahead of this event, from the respondents from there, 78% of people actually said they'd found technology helpful, and actually we were kind of questioning whether that was a bit of a surprise figure, really, that actually with all of those things that you've mentioned there, that such a high figure found it actually helpful rather than a hindrance throughout. And Grant, just to put this to you, do you feel the pandemic experience has been similar over there, in Australia, the same as the issues that Andy's talked about there, and just relating that back to your own experiences?
No, absolutely, Jenna, and exactly what Andy and Julian said. In Australia, well, around the world, but in Australia, police in particular have gone from one crisis to another, really in 2020. I mean, for Australia, we had the horrific bushfires earlier in the year, just sort of got over that, and then COVID hit. And then in COVID, we had the Black Lives Matters. Over here, we had issues with immigration and detention. So it's really spread the resources, a mile wide and an inch thick. But one of the things that I noticed in the data was, and it's fairly consistent with what I've read around the world, is there's still about a third of people that said that that the actual technology was stressful to them. And I'll just go back into some Greek philosophy here. Don't fall asleep. But Heraclitus put it eloquently, the Greek philosopher, about 2 millennia ago, that nothing new comes into our lives without a hidden curse. And I think from what I've seen, in particular with the difference between the digital immigrants and the digital natives, is that those that are the digital immigrants, much like myself, have struggled with as Andy mentioned, with the overwhelming thrust of technology. And some of the things that I've spoken to people about that they've struggled with are the I guess the emergence of techlash, sort of driven by the disillusionment with the online environment and the worries over digital dystopia. the isolation aspects that we've talked about, and the from a human interaction, and the increased balkanisation of knowledge and understanding, but also too the fact that there's issues with regard to this, but much of the algorithms that are designed around technology have evolved without sufficient consideration of the social empathy, inherent bias, and they're the stresses that we see. I mean, as the generational shift happens, the new people coming on board who have grown up with technology are going to be fine with this, but we're still in that sort of shaped phase where we've got a lot of people that, as Andy said, haven't been trained, don't really understand it, but are expected to really embrace it. And it's hard to do that when you're at a normal pace, let alone when you're in a situation like COVID and like Australia has had with the bushfires.
Yeah, absolutely. Julian, I don't know whether you've got anything on that from your view, from your sort of tech perspective, in terms of that transition really in our workforce, that we do have this culture where we have people from all ability levels when it comes to technology. Have you any observations on that from your perspective?
Yeah, a number of things. I mean, first of all, the tech industry is not done. It thinks it's done a better job than it has over many years. I've been in the industry a long time. We keep saying this stuff's easy to use. The word that always brings me out in spots is when people say it's intuitive. And it isn't. The other thing is, a complete and utter reliance and dependence on tech by itself, as we've seen with things like the A-levels challenge. You've got an algorithm. Yeah, but what was the algorithm designed for? Have they thought about the people? Have you thought about the implications of this? You really can't just, the computer says no syndrome or the computer says yes syndrome. Computers are tools, and you have to design their use around people. If you don't do that and you don't make it appropriate for the different people to use, and then you don't provide the right training and support, then either people won't use it, or they will try to use it, and you will get a strange result, a strange activity. So, I think the tech industry needs to be, and is always, very open about that. You need to understand the limitations of this stuff, and we need to understand what you're trying to do with it. If you can get those two things together, then that helps. I do think Grant's point about, I'm not sure it's generational in a sense, Grant, because you hear plenty of. We did some work recently with one of our members, and we surveyed people over 70 and their use of smartphones and computers and so on, and it is remarkable that they do use them a lot. But what they do is they use them for things they want to do, things that they are able to use, understand, etc. You've got to catch that with more senior officers, with officers that have been in the job longer, or with people doing something, to have a very complicated interface in an operational tool that an officer's trying to use while they're dealing with a very difficult situation, physical situation, danger, etc. It's not going to work. So the thing has to be designed. Where I do think that we are seeing great progress, and I mean, it's really interesting, the stats on the rollout of Microsoft Teams in the National Labouring Programme. That's a really strong success here in the UK. I'm sure you've got the same examples, Katie and Grant, in your own countries. Is you can actually take large parts of the job, automate them, make them easier. But again, you've always got to think about, but how does this look to the user? How does this look to the ordinary constable or officer doing their job? How does it look to the support staff? How does it look? I see comments about special constables. How come you don't have special constables included in the team? What's the extended team and who does what? How do they get the training? And I'm afraid there isn't a shortcut to this. We tell government this all the time. You've got to spend the money. You've got to put the resources in. It will pay off if you do it properly.
And it's a good point, really, about making technology accessible in various different ways, and there's lots of different ways we can do that. And on the panel, and we've already heard from Gary today, so I want to bring Gary in at this point, really. One of the things that you've worked on and you've introduced across police, and specifically for wellbeing, is the Backup Buddy app. And that is something that is essentially relatively sort of easy adoptable for people, and that it is a an app that people tend to be used to as something on their smartphones as part of their own daily business. So I just wondered if you'd be happy to maybe talk to us a little bit about whether you've seen any sort of influx in the use of that app through the pandemic, and if you've got any particular observations that you think fit with the discussion.
Yeah, thank you, Jenna. The Backup Buddy app is in itself a really simple app, and it's something that anybody can use. It's very, very simple, and in its simplicity is its strength, because it doesn't purport to be anything that it's not. It's a mental health app for police, and in a organisation where there is still sadly stigma around mental health, we're really keen to point out that actually this app is for police officers and staff within police organisations, because we are no different from the 1 in 4 out there. We suffer from mental health problems as well. So within the app, we've got people from their home organisation telling their stories and telling in a powerful way, bravely standing up and talking about issues that have affected them. And that's the sort of thing that other people can relate to. So that has been quite successful in getting the message across. With that, we've also got lots of information about all the different kinds of problems that people have got and had, and signs and symptoms for people to look out for, things for supervisors to be aware of, looking after their staff, the best way to do that, the best way to help them if they go sick, for example. And each organisation that's got the Backup Buddy has made it bespoke to their own personal routes to and pathways to support. So it can be what any organisation wants it to be. And what we've found is that there are more and more people now who are coming to us and saying, can you make the Backup Buddy for us? We've got it in over 14 police forces. We've got fire and ambulance services that have got it now. And we've got one of our police forces in Canada have also got it. And each one is slightly different, because each area is different and people are different and the problems that they experience is different. So it's made bespoke for everybody, so that they can get out of it what they want. And it's only ever going to be as good as the input and the people who champion mental health put into it. So if people have got initiatives in their force, we're piloting a sleep initiative, that's going to be on the Backup Buddy, because we want people to engage with it. And these days, people's interfacing at computer desks is it's a thing. But when you're out on patrol and you're trying to look after a crime scene, you haven't got that access. So having a simple app that you can access 24/7 is really, really quite important. So the actual use in terms of people using the app over the pandemic, I haven't got the figures for that, but I know that there's certainly a lot more inquiries that we've had about people wanting the app and how they get access to it and how it can support them.
Brilliant. Thank you, Gary. Just on that, as it works well as a question now to Grant, actually. Grant, you've spoken about your personal experiences with mental health. Do you think that things like this app and technology might have been helpful then for you?
Absolutely. And I mean, when I joined the police, the best we had was a typewriter, and that was usually one amongst many. Had I have had access to the technology, and had I been able to use it, it would have helped me a lot, because I had a lot of questions that I needed to ask, but I didn't want to ask anyone because of the stigma, because of the culture in policing, etc. And it's kind of like you're trapped in your own dungeon. I'm so glad to see the likes of the apps that Gary's talked about and some of the others that are operating in the US, because that element of anonymity in the early stages of when you're going through a mental health issue is so important while you're trying to get your ducks in a row, so to speak. So I absolutely think they're worth their while.
Brilliant. Thank you, Grant. That's really helpful. And I think it's come through in a few of the speeches, actually, that point about it being used for communication and access for people to a community of people to be able to access what they need or have a conversation or reach out to colleagues is really important. And I think actually that will probably lead us on, just in terms of time now, into a 5-minute question and answer session. And we're going to pick up on a couple of the questions that have come through on the group chat. And once we've done that Q&A, we're going to give you all a little bit of an exercise to do just for a few minutes, but we'll go straight into the Q&A first of all. And one of the first questions that's come up, which fits into how we've just left that discussion there, is that there's a question here around needing to support frontline officers more with technology and getting messages and information to them. It's far easier working from home with technology, but frontline obviously don't often have as many options to do so. So it's just whether we can, as a panel, maybe have a think about what we could do more externally, whether it be a social media platform or a national police app. Don't know whether Julian or Gary, you want to come in on that.
Gary.
Sorry, after you, Julian.
So, I mean, I've been reading the threads as well. Some very interesting points coming through, and I do think this question of accessibility and visibility of leaders. There's also this thing about, is everything going to be online in the future? No, it's not. I mean, people are people. And that element of social contact, which is now being more regimented and harder to get to, does mean we need a hybrid future. We shouldn't, as Andy said, we shouldn't snap back into our old ways. But equally, we shouldn't think that we're all going to be some sort of science fiction futuristic interaction with robots, etc. What I do think is very important is leaders need to make, and leaders are people up and down the organisation. One of the things that's come through in our small group, our 70, is we found other leaders, people quite junior in terms of their formal role within the company, who are taking leadership roles in some of the activity with their colleagues. And that, I think, needs to happen. Leaders need to be visible, they need to be accessible, and you've got to put more effort into it. You've actually got to do that, which also puts stress on the leaders, and they need some wellness support as well, because there's this problem. Gary, I'd be very interested in your perspective on this always on thing. I find I can manage that. It gives me a huge amount of flexibility in terms of I still was able to have my holiday and join you today, as I mentioned, because it's very easy with the technology. But you do have this problem that, you wake up in the morning at 5 a.m., 6 a.m., whatever, and the first thing you do is you switch on your device, or it's on already, and you look at messages and so on. That can become oppressive throughout the day, and you need to make sure you avoid that. The other comment that came through here was frontline officers can't always read a whole bunch of spell. It's in the guidance. We've sent out a document. Of course, you know how to do this because there's a webinar. You really got to think this stuff through and make it appropriate and easy for people to connect and understand what they're doing. Gary, I'll stop there and ask, what's your experience been?
I totally agree with you. I think bullet points is how I speak on the app, and I think it's a really great way to get through to people who are limited with their time. They haven't got time to read rafts of information, so you need to be able to boil down the absolute bits and pieces that they need and get it out to them, and you've got to make it accessible. Always on, that's the kind of age we're living in, and funnily enough, through the sleep studies that we're doing, we're learning that actually it's a really good idea to just make a rule about technology and start living a lifestyle where, after a certain time of night, whether it's 8 o'clock or 9 o'clock, you ditch your technology, and then you pick it up in the morning when you're ready to do so, because it's easy to be surrounded by technology and dip into it and dip out of it 24/7, but actually that's not good for you. That's not good for your health. It's certainly not good for your mental health. And I'd just like to thank Laura for her comment about when she spoke on, told her story on Backup Buddy, it was well received. That's what we're finding. when people actually speak from the heart about their issues, they're connecting with other people. So technology can connect people and it can bridge those gaps, and it can help people who are working remotely, but we shouldn't rely on it, and we should be careful about how we use our technology so that it doesn't overtake us. We should be in charge.
Absolutely brilliant. Thank you, Gary. Unless we have any other of our panelists who want to come in on this, I just wondered, and we're going to move into a very quick activity, but we've got a little bit of activity for our panelists first of all. And could you just give us, each one of you, and I'll ask you each one in turn, just an example of your favourite tech? So Gary, you're still on my screen, so I'll come forward to you first. What's an example of one of them? The best
Zoom.
Zoom.
I love Zoom. I use it for work and with the charity, and it's just brilliant.
Perfect. Andy, I don't know whether you'll say Zoom or not.
Yeah, Zoom, definitely. I like Zoom. Far better. It's less clunk, and use it on the iPad.
Julian?
So I would echo those, but you know what? I still use text, and what I try to do, picking up the point, Gary, about turning the tech off, is hierarchy of contact. So for fast contact, people know that I'll see a text. Emails I won't necessarily see. I might be in the Zoom or the Teams environment. I might not. So does that sound a bit Luddite? I'm still using text.
Not at all. And Grant, how about you?
I've got to say, agree with everyone, but I'm passionate more towards Twitter because of the instant feed, because of the you don't necessarily get the junk that accompanies a lot of other platforms, but also too you can get messages out very quickly to a broad spectrum of people.
Brilliant. So on that, I suppose connection kind of brings us back there. The quick activity that we just want you all to think about, we'll move on to the second panel now, but just while we do that and I introduce the second panel, we want you to have a think about the people that you've been able to connect with or reconnect with thanks to technology during the pandemic. So just want to give you kind of 30 seconds to try and come up with a list of maybe around 5 names of people that you've either connected with or reconnected with. We'll just give you 30 seconds to have a think about that now. And then once you've done that, now think of 2 more people who might be missing from that list that you would want to connect with, or you feel you've missed an opportunity to connect with. And then we want you to have a think about a plan of how you might reach out and connect with them soon. So if you are making notes on that, we'll leave you to make those notes while I introduce the second panel. And before I do, just quickly thank you to Grant and Julian, and particularly, I know Grant, with it being very late where you are, and Julian with other commitments, just in case you don't stay with us for the full duration to the end of the conference, just at this point, we'd like to say thank you very much, but please do, if you have the time, please do stay with us. So our second panel discussion now, we've got Andy Rhodes again leading the panel, and this time he'll be joined by Dr. Kati Kamkar, Jeff Thompson, PhD from the New York Police Department. Jeff is the NYPD's first ever mental health and wellness coordinator and is currently conducting research at the New York State Psychiatric Institute at Columbia University Medical Center. And completing that panel is Hector McCoy, who's a Chief Inspector from the City of London Police, and he's bringing us in this panel that critical frontline perspective. So this panel discussion is where we'll focus on how we can stay well during these pandemic times and focus on some wellbeing activities in action across policing. And so we're going to open up the panel discussion here by handing over to Kati first, and asking you, Kati, what's important from a psychological perspective to feeling well? And what interesting practices have you come across during the pandemic in Canada?
Yes, as we know, of course, there are a host of very important proactive strategies and well-being strategies that we do need to adopt and have been well documented. So in addition to all those that ideally we will want to practice every day, what I would like to focus on is to, once again, as I had mentioned, what are some of the key specific workplace strength and protective factors that we can adopt at both organizational and the individual factors. So I would like to emphasize in regards to those because they actually have been found to improve our functioning, reduce disability. That's again irrespective of the traumatic events and the stressors that we might be going through. The first one is the compassion satisfaction. Once again, because we're talking about we are in a human care profession, in a human service profession. So compassion satisfaction has actually been found to be such a significant protective factors. And again, to boost our resiliency, we need to build our protective factors and to always protect our protective factors as well. So compassion satisfaction is the contentment from being able to do one's work and helping others. Now the question is, okay, well, how do we maintain and build compassion satisfaction? Because we have actually noticed that within the policing, compared to general population, compassion satisfaction tend to be more down, which again, we're not it's not a surprising finding. So from compassion fatigue, so the first one is, again, I would like to have everyone take please your paper pen or your phone so that we can practice those every day, focusing on the meaning of our work, the positives of my work. The second one being how helping others help to maintain my own personal growth, my psychological growth. And the third one is being proud of my accomplishment, being proud of my hard work and appreciating my impact and my involvement irrespective of the outcome. More often than not, we don't have control, or at least full control over the outcome. Nevertheless, we want to recognize our positives and our hard work. So these are some of the key strategies that help us to build compassion satisfaction. The second one being professional worth. So the perception that my work is being valued, my work is being recognized and appreciated. And certainly this is something that we really need to focus on at the organizational level. The third one, self-compassion. Whenever we go through a difficult time, to a time that is very challenging, it is the self-compassion that has actually been found to buffer against the risk of compassion fatigue and the burnout. So self-compassion, three main categories within it. The first is this mindfulness approach, the need to recognize a range of emotions, the need to recognize a range of thoughts, not to be afraid of them, but so that we can take a more objective stance and being able to put them into perspective. And then we are able to make healthier decisions. And this mindfulness actually helps to reduce our tendency to overly identify with our distressing thoughts and our emotions. The second one, as part of self-compassion, self-kindness, because it does help to reduce our tendency to engage in self-judgment. And the third one, the sense of humanity. Everything is imperfect. We are not able to achieve imperfections. Yes, we do make mistakes, but recognizing that we are a human being and it comes with imperfection helps to reduce self-isolation. Once again, some of the key strategies for us to practice every day as part of building our self-compassion. And the other components I would like to mention is the psychological flexibility that has been found to be such a protective factor. It's not only when we build goals and expectations, but being able to revise our goals, revise our expectations when circumstances change. So the more we are able to adopt that flexibility, it actually helps to reduce our tendency to, again, engage in negative self-evaluation, and we are better able to make healthier decisions. And finally, the coping flexibility. There's a lot of mixed findings around, well, do we engage in avoidant coping, or this avoidant coping has been associated with psychopathology, and is the approach coping that is healthy? Not necessarily. It is really the ability to engage in coping strategies flexibly. Sometimes, yes, it is the avoidance strategy that is going to be helpful. Sometimes it is going to be the approach strategy that is going to be helpful. And some coping strategies could be both. So for example, it could be, yes, I want to go out with my friends and have a meaningful time and really not think about anything else, just maximize my fun. That is great. It does give a healthy distraction that we all know sometimes is very helpful. But sometimes it can also be that we say, oh, I want to go out with my friends to have a quality time and also seek support, because to talk about all my concerns, that is then again also an approach, a strategy. So as long as we know how to utilize them flexibly, it is related to protective factors. And of course, I can go on and on, but I'm going to stop here and follow up later. Thank you again.
Thank you, Catty. That's brilliant. If anybody is interested in more of what Catty's talked about, we have published some of Catty's work on the Oscar Kilo website, so you can grab that from there. Just to bring Jeff in at this point. So obviously you research and develop methods to improve wellbeing across the NYPD. Can you talk to us a little bit about your work and how that fits in with what Catty's talked to us about?
Yes, certainly, and thank you for having me. And it's never easy coming after Catty because her work is brilliant, and I like to think whatever I'm about to say, Catty said it beforehand, and it just shows whatever I'm trying to do is based by solid research and science. So Catty and everybody else, it's great to be with all of you. And a lot of it, I'm not going to repeat what she said, but the perspective I want to share is taking what she said, because it must be science-based. It must be evidence-based, based on research, because we can't just do programs. We can't just throw something at the board, see, hey, does this work? Or let's try this, or base it on anecdotal stories. Well, I tried this, so let's make the whole agency do this. It's just, it would be silly and laughable if it wasn't this serious. And we're talking about the well-being of our workforce. And resilience and mental health is something every single man and woman in our agency deserves. And we've got to figure out what's the best way and how to adapt, or as Catty said, being flexible. When we talk about resilience, it's from two perspectives, the micro and the macro. The micro is the personal resilience. The macro is the agency-wide. So what have we done, especially given since recently COVID? We've had to adapt, right? None of us, any agency, anybody on here, we're not throwing our hands up and giving up. The NYPD, we've been around for 175 years. We're not going anywhere. We're not quitting. And from that perspective, what have we done? And again, it's just giving examples of what we've heard, the constant communication. Because what happens if we're not putting out messaging on what's going on? People make up their own stories. And usually those stories are a heck of a lot truthful and a lot more colorful than what the real story is. And what I say with the group that I work with, even if you don't like the answer, it's the answer. And it's better than not knowing what the answer is. And how do we do that? It's a variety of things. And it's not just one. It's definitely Zoom, emails, messaging, text messaging. We have an app on our phone. Every member of the service has a mobile device. So we're able to access our whole workforce fairly easy. But it's also, we can't ever forget the in-person. We still go out and we do roll call talks. Of course, we all have one of these with us and we keep our distance. One thing, how important it is trying to connect the science with the idea of practice is how much words matter. And everything that I'm trying to share and what we've heard before, these aren't cliches. I think we're all past that point. But how important words are in the emphasis of, we try to avoid using the term social distancing. We talk about physical distancing, especially in our outside lives, the social connectedness, how important that is. We're not distancing ourselves from our social connections. We physical distance ourselves, especially like I always say, if you're in the supermarket, I was never social connecting with the person online in front of me. Right? They're not my friend. I want to buy my groceries and go home, but it's physical distancing now we're making sure. But we've got to figure out ways to maintain socially connected, because this stuff, and again, Catty and the others, it's hardcore resilience. It isn't soft, touchy-feely stuff. And it's backed by research and data. And this is the other thing too. As much as I love this webinar, God bless it, all these books, all these workshops, that doesn't make somebody resilient. Resilience is made and enhanced by the actual doing. And that's why I hope something like this webinar and those videos, podcasts, those are intended to motivate people to do that next important step too. You actually have to do it. And I love the head nodding, the smiles, everybody. Maybe it's just my accent that's making some of you laugh, or me speaking at my usual New York pace. But it's the idea of time. I just looked at my watch. Is it on my side right now? But in the minute and 38 seconds I have, I think it's that idea of take whatever that feeling you have of looking after yourself. Because again, as a caddy, I keep referring to you. It really is on my notes of a madman here. It's that self-compassion. Let's grab that for a second. That's legit. That is legit. And that's where I honestly think we've slightly passed that stage of people being dismissive, men and women in our workforce. People are realizing, and they nod their head, especially the ones with more time on, they realize because we've learned the hard way. And these newer officers, yes, they are another generation. And I think they're more open to it. So as bad as everything is out there, and we've got to acknowledge it's bad, it's awful. But if we're going to make time for the bad, we sure as hell got to make time for the good. And it's these little moments of gratitude. There's these little moments of stopping to reflect, again, which somebody said earlier, Caddy, and a few others, but it's finding purpose of your daily work. And plenty of the uniform members on here and listening to this later, it's you do great work every day. Yes, that's the giving, but here's the neuroscience behind it. Taking a moment to actually stop and pause and think about one good thing you did that day. And then one good thing somebody did for you. And it is clear and obvious, but that's where you're making stronger neural networks in your brain. And the last thing I will say in regard to that, the bit of the neuroscience behind that is when you build those more neural networks, it doesn't negate or make all the bad stuff go away. It makes you better able to handle it and take care of it. And that's what the personal resilience is. And stuff like Ian, I know he's on here. He's written great work on it. That's where the agency can embrace that and make it department-wide. Thank you.
Brilliant. Thank you, Jeff. That's fabulous. Just on that note, actually, talking about sort of the culture and the organisation, grabbing hold of those sorts of things. Hector, I wonder if I can come to you now, maybe just from your experience as a senior leader in your organisation. What's been your experience of sort of policing through the pandemic and some of those initiatives and those, I guess, kind of coping strategies that you've seen come through in that time?
Yeah, no problem, and thank you. I suppose policing through this pandemic, especially from a leadership point of view and relating that to a lot of our frontline officers, but not only our frontline officers. I've also got a number of officers and staff that work in the back office as well, i.e., on the radios and so forth. And it was equally just as important for them to know that they were looked after, they were listened to as well. I think like a number of forces, we're a little bit slow off the mark in terms of understanding and dealing with what we actually had in front of us. And by that, I mean a number of the staff would be concerned about coming into work, how they're coming into work and what they potentially could pick up, catch or what on their way into work. So whilst they're at work, we've got a responsibility in terms of looking after them under health and safety regulations and so forth. And that was really important in terms of the environment that they were working in, that they felt safe and secure whilst they're at work. And that's part of my responsibilities as well as a leader. So in terms of, I say the silliest things, sanitizers and so forth, face masks, PPE and all that kind of stuff, making them available to our staff was absolutely crucial, and let them know that yes, they can use it, and some of them would and some of them wouldn't. But equally, for me, as a leader, it was also about talking to my staff as well and listening to them, because they clearly would have concerns. And as the two other speakers have already picked up, that was pretty crucial for me, because it was understanding their concerns from themselves and equally what was going on with them at home as well, because some of them could be on the front line and then some of them are clearly, like I said, would be in the back office and felt that actually all of the attention was all on the frontline staff. So that was really important. And it's also the issue around valuing your staff as well. We do it and we say it a lot, but I think during this pandemic, it was really, really crucial to let them know that you do value them, the role that they're doing, the work that they're doing. Again, like I say, for those in the force control room, one of my areas is to let them be aware how much certainly I value them, the organisation valued them, and more importantly, how much the community valued them. But the frontline teams, again, it was really, really difficult for them at first. Did we need all of the teams on? So if we're working with 15 in our team, did we need 15 on? The short answer to that was no, it wasn't, because we saw lots and lots of people coming off the streets, lots of vehicles come off the streets, and there was hardly anybody about in the city, in the square mile. So it was important that we didn't need that. So it was about looking at that, looking at the roster and can we split them? And that's what we managed to do. So we were splitting the teams in two. And likewise, again, in the control room, split those teams in two. We don't need everyone on all in one go. But equally, it's that conversation with the staff and asking the staff, well, listen, what do you think will work best for you as well? Because as I always turn around and say, I have not got all the answers, but if you ask your staff, they will give you some of the answers. And then it's down to me as a leader to make those decisions in terms of how we're going to go forward. So yeah, kind of like twofold: talking to your staff, valuing your staff, appreciating them, making sure, like under health and safety, you're doing the things that you've got to do once they're in work, but listening to them also, some of the anxieties that they would have and some of the worries that they would have away from work, because as we all know, it's what sometimes goes on in their own life will impact in terms of their well-being and their productivity when they're at work. So that was equally as important for me. So as I said, communication was absolutely key. Messaging was absolutely the key. I think what was really important is getting, again, one of our senior leaders, our commander, was getting him to come in and see the teams as well and speak to the teams and value the teams as well, as much as he could. We'll talk about visibility and leadership being visible as well. I will take that to an extent because it's also equally important for me that you practice what you preach. So whilst visibility is important, you also can't put yourself in a position where actually you can be bringing something into the workplace as well. So the teams have to be able to see that you're practicing what you're preaching, and all that just led for a lot smoother and a lot easier ride for a lot of the teams. We're talking about buddy system. Again, it's those communications with your staff to look out for each other, to look after each other, from our sergeants and the inspectors' point of view, to understand your staff, to have those one-to-ones, which was really, really crucial. Any risk assessments that had to be undertaken for your staff, to have those conversations with them. So you're finding out if they have got the anxieties, if they have got the worries, if they have got the concerns at home, people self-shielding, all that type of stuff. And equally look out for any kind of impact that it will have on them when they come into the workplace.
That's brilliant. Thank you, Hector. Andy, just to bring you in at that point, have you any observations on what Hector's talked about there, specifically around some of those wellbeing interventions and those experiences that people have had, day in, day out as they come in to do their job?
Yeah, and there's quite a lot on the thread here about leadership, because my now departed dad would always say to me, the best time to fix a leaky roof is when the sun's shining. What we don't want to see is leaders who all of a sudden causes a pandemic and they're worried about bums on seats, are starting to display behaviours that aren't genuine and authentic. So if you've got a leadership or a leader, we've all had great line managers who actually care about us all the time. So the sort of things that Hector's talked about, where he's already established a degree of trust with his teams. Therefore, when something like a pandemic happens, they actually believe that he's doing what he's doing for the right reasons. I think that's a big thing that we learn from wellbeing, that you cannot do it falsely, you can't be inauthentic about it, because people will see through it. And wellbeing and resilience should never be used as an antidote for a badly functioning organisation. The stuff that Jeff, Katie, Grant, everybody's talked about here. Some people think we're putting all this investment in because actually we don't have to focus on running a great organisation. The whole organisation approach that Katie talked about is the key to this, because if you haven't gone into the pandemic, it strikes me as the comments on the thread and what the speakers are saying is, if you haven't gone into the pandemic already in a good place around this, then you're going to be playing catch up very, very much so in the crisis situation. So I do think that this sort of holy trinity of workforce insights, having leaders who can engage, having diagnostics that can pick up what the frontliners thinking and feeling about technology, well-being, etc., with research and tapping into some of the amazing research with the people we've got on this call, but also the executive genuinely committing. I think that's the holy trinity for me, Jenna, because when you look at what's coming out of today's call, it's clear that actually our staff are going above and beyond. You look at the absence levels in policing, certainly in this country, and I think, I've spoken to other people in other countries. They are staying at work and continuing to work in very, very difficult circumstances, will that goodwill run out if they see that this isn't genuine and authentic and we don't continue some of these this investment?
Yeah. And that's perfect, Andy. It's as if you looked at the time and timed that perfectly. 2:15, we're going to move into the Q&A. So there's a couple of questions that have come up along the way. And like I said before, we'll pick up the questions we can in the time that we've got, but we'll go through the chat function afterwards, and any sort of key points or any questions that come out that we don't get a chance to pick up on, we, of course, will acknowledge those afterwards and we'll publish those in the post-event roundup. But one of the things that came through from Jackie C, I think, was around the support being given to special constables and volunteers who might not be on duty or in the office for a number of days and weeks. And again, this probably comes back to the community and the communication that we've picked up on already. But just going to throw that out there to the panel, anybody who wants to jump in on that particular aspect around volunteers and special constables.
Okay, I can come in on that one, Jenna. So what we've been doing is, a lot of the teams, again, like I've mentioned, they've set up their own WhatsApp group, and they've been contacting each other in between the WhatsApp group, which has been proven to be a success, certainly amongst themselves. And I was slightly annoyed that I wasn't involved in one of them, but they said they didn't want me in there anyway, so fine. So in terms of keeping contact, that's what they've been doing. And it's a really interesting point that you make around the special constables and certainly the volunteers. So personally, I'll make a point of actually, there's a couple of the special constables which I know, and I'll make a point of contacting them and letting them know, listen, if you need me to come to one of your musters, I'm more than happy to come and do that. And none of them's taken me up on the offer yet, but they appreciate the fact that we've kept in touch. Likewise with volunteers. So where I've got a couple of volunteers on my teams, what I've made to do is I've involved them in everything. So whether it be the WhatsApp group or the meetings, or I'll carry out one-to-one meetings because where we've split the shifts of staff coming in, that I make sure that the volunteer, where they can and they're happy to come in, that they will come in and be part of that, or using the technology in terms of Zoom. So as far as I'm concerned, the volunteers and special constables absolutely have not been left out of this at all. They're part of the team and they're involved.
Brilliant. Thank you, Hector. That's really, really helpful. And I think what's also interesting there is that, in the wellbeing world, someone said here that you need the right people in. You need them not to be there as a portfolio or not for promotion, not as a tick in the box. It needs to be people who care about their people and want to make the workplace a safer environment. And that's come from Phil Spencer over in Cleveland in the UK. Again, just anybody wants to pick up on that point, really. And again, we've touched on communication and leadership, but I guess it's around that, having those people around who actually genuinely care.
Can I jump in real quick, Jenna?
Of course.
Just one quick thing I want to say with that, because I say it internally, I always say it externally. I'll keep it as tight as possible. It's that idea of culture. And I think acknowledging where we look to try to create that culture of genuinely caring at all levels, it's that admittance, though, there are people that are jerks in our agencies that aren't buying into it right now. And I always say very emphatically, if you thought I was into it before, this is one of the times where I become the most into what I want to say is if there's people that aren't buying into this, two things. Either one, get out of the agency now, leave, retire, vest out. You're not welcome. You never were welcome, especially during now. We don't want you here. But there's still, point two is there's still always an opportunity to change and giving them a chance to change their perspective. And how do we do that? And I saw someone right in there. It's a simple math formula. We make there be more of the us and less of the them. And when there's more of the us that actually give a crap of all ranks, those people that are being negative to each other, then they feel like they're not as welcome anymore. And then they realize either A, they should stop, or maybe it's best for them to move on. And we've got to figure out more ways to push that needle a bit more in that direction. Thank you.
Thank you, Jeff. That's brilliant. Just picking up on something that's come from Faye Lowe at the NCA, who said she was really impressed with Wiltshire, which is a county in the UK, their support for families of officers through the Salisbury poisonings. And Keir Pritchard, their chief constable, came and did a presentation at last year's Oscar Kilo conference, which was really well received. So it's just actually picking up on that families aspect, actually, and what kind of support is available, not just for officers and staff who are at work, but that support for families more widely. If anyone's got any views on that.
Can I jump in for a minute? Edith from Natal in Israel. I have been in the Israeli police for many, many years. I was head of the mental health department there. And what we did, we opened, I just wrote it in the chat, we opened a helpline for the families because we thought that it might get a load off the officers' shoulders, which means if we take care of the families, they are more free to take care of the citizens or do their job. Because we know that when they go back home and they have all this load on them, then, you know, the concentration and the mood changes, everything is influenced by it. And so the helpline was specified for the families, children and wives or husbands of the first responders. So it's just an idea.
Brilliant. Thank you very much. Thank you. On that point now, we're just getting to 2:20. So before I hand over to Andy Rhodes to wrap up the session for today, we do have one final activity for you. And what we would like you to do is note down one new thought or idea that has been triggered by the discussion today, and one new action that you will take as a result. And you can either share these in the chat function if you want, or you can keep them to yourself, of course, also fine. So what we'll do is we'll give you a few minutes just to make a note on that. And at this point, I will hand over to Chief Constable Andy Rhodes to wrap up the session.
Well, that's a pretty big challenge, that, Jenna, because I was really getting into the flow of things there, and Jeff was getting so animated and passionate. I was like, I'm signing in for the rest of the shift, Jeff, you know. I think if you'd have strayed into this conference that we're doing online and you didn't know beforehand that it was attended by people from literally the four corners of the globe, you could be forgiven for thinking we all work in the same place, because there's massive consistency of issues coming up on the thread. The speakers have all talked, and they haven't spoken to each other, any of the speakers today, prior to today, to get their act together. They're just talking about the same things in a very consistent way because of the work that they've been doing for many, many years. And so for me, what's really come out of today is, you know, what we wanted to do was really get in touch with what's happening out there for the people who are on the sharp end of this in our organisations, try and understand what their lived experience is and how we can actually connect to them using technology, other things such as leadership behaviours and the researchers out there to actually keeping society safe. And I do actually think that there is a little bit of complacency in general society that particularly blue light workers, your NHS critical functions, your health workers, will always keep doing what they've always done. And I'm not sure that that is something that we should be complacent about, because without the things that we're talking about here in place, people can and will and do remove their discretionary effort, as Ian Hesketh has pointed out in many of the articles that he's published. And discretionary effort saves lives and it keeps society safe. So, you know, I would say this as somebody passionate about wellbeing, but for me, COVID is demonstrating that it should be at the front of everything you do in an organisation, not as an afterthought, because it's about everything that we're hoping to achieve and creating a great working experience for the people who do what is an incredibly tough job, isn't it? So that's sort of my final thoughts, Jen. And we really want to thank the people who've taken the time out to dial in today, put comments on, and the speakers. Fantastic. I'm buzzing.
Brilliant. Thank you, Andy. And just before we go out, I'm going to wrap up the session very shortly, but we do have one little poll for you just before you go, which Georgie hopefully will be able to put up for us. And that is just to ask you how useful you found the event today. So if you do want to just quickly take a second to vote on the poll and give us some much welcome feedback, that would be brilliant. So while we're just finishing off with that poll, first of all, we just want to say thank you very, very much, as Andy has said, for everyone's time today, for the speakers who've been able to join us, for all of our panellists, and of course, everybody who's contributed to the chat. We are overwhelmed with how much information has come through there, and we won't miss any of it. So after the event today, we are going to do a roundup piece so that people who weren't able to join us can learn from what we've done today. As I say, the event's been recorded, so we'll make that recording available as well if you do want to share that with colleagues after the event. And what we will do is we'll share any links or information that have come through in the Oscar Kilo resources section. There's an international section under there, so we'll pull everything through into that section for you so you can find it all really easily, and we'll signpost you through to that from our social media channels as well. Just a very big thank you there to see that over 80% of you have said that you found the event useful today, which is brilliant. That's what we're all here for. We're here for people to learn and to take things away, so that's fantastic. So one final plea from me: access the information on the Oscar Kilo website, continue the conversations that we've started today, and thank you all very, very much once again from all of us at Oscar Kilo, techUK and We Need Social.
Thanks, Jenna. Thanks, everybody.
Thank you, everyone.
Thank you.